My name is Lisa Fairweather. I am part of the communications team here at DHSV. My title is officially Media and Communications Officer, which involves basically report writing, press release writing, speech writing, editing, putting together brochures, pamphlets, all sorts of different things. Some of you may have met me running around at events like this, see me running around like crazy, but it's actually quite nice to be on the other side of, well, not nice, but different to be on the other side of it today. First, I'm going to take you on a journey through our rebranding exercise and hopefully inspire some creative thinking amongst you. Second, I'm going to walk you through the experience DHSV has had with our social media, and again, perhaps inspire some of you to take a bit of a leap of faith there. And finally, I'm going to show you how I can potentially help you in your service to gain some media coverage with traditional media, which will help to bring awareness of the services you offer and help the community to realise the value of public dental services everywhere. Now, just trying to find my pointer. Okay. So, what is branding and why is it important? Before I can walk you through our rebranding process, I just want to touch on branding and exactly what it is and why it was important for us to get it right. A brand, by definition, is an easily identifiable entity that gives a sense of value and professionalism to a product or service. It includes all aspects of the product or service, but it revolves mostly around the visual parts of it. So what is that exactly in English? Well, it's the logos, colours and graphics that we all know so well. In fact, there's an app at the moment that that's going around, and it is posing as a game, I suppose, where it tests the user's ability to recognise logos from different brands. Some of you are nodding, you've seen it. I bet that some clever marketer somewhere has made a mint on selling that information back to those brands, but that's exactly what branding is, being able to recognise an organisation or a company just by its logo. It's the daffodil for the Cancer Council, it's the Heart Foundation tick, it's all of those things that you know so very well. So think about some of the brands that you might see every day. You've got your Coke, McDonald's, and why does their branding work so well? Basically, it's consistent, and it's easily recognisable, and it's simple. 3 key things. There's nothing too in-depth about a McDonald's logo. It's a big M. Everybody knows what it is. When done well, your branding will mean that not only does the consumer recognise your brand, but they understand the qualities that make your brand better than somebody else's. Good branding is also brings with it a sense of professionalism, which is important because we want our product to stand out in the ever-increasing clutter that we see on buses and trams, billboards, posters, everywhere. It's in your face. So we need to be able to stand out in that crowd. There are a few benefits to strong branding. Again, this is a bit of the theory stuff, but it's probably helpful to understand this before we dive into it any further. Branding creates trust and an emotional attachment to your product. It causes decisions to be based by the customer, at least in part, upon an emotion rather than anything more practical. So, for example, a logical versus an intellectual decision, buying Huggies nappies over the no-name brand because they're cheaper. Just because they have a good brand doesn't mean that they're any better than any of the other competition. Customers will automatically think of you first if you've got some good branding happening. Think Apple with touchscreen phones and iPads. They don't necessarily do it any better than anybody else, but their branding certainly says that they do. A solid branding strategy communicates a strong, consistent message about the value of your organisation. It signals that you intend to be around for a while, so you're not just a flash in the pan, you're going to be there for a while. It impresses your identity upon potential customers, so people who don't know you will know you once they see your brand around. Now, that's not necessarily going to capture the immediate sale, but it certainly will influence the sale once you're in a supermarket and you see a brand you recognise, you're certainly going to pick that over something you don't. It builds name recognition for your organisation or service, so again, it means the recognition is there, and will help you to articulate your organisation's value. Now, what that means for DHSV. When we started, before I go there, think about your organisation's logo. What do you think it says about you and the services that you provide? Is anyone happy with how their brand looks, feels? Everyone, yeah? That's good. That's a great place to start. It's great. Sorry, excuse me. I'm going to take you on a bit of a time travelling journey, I suppose you'd call it, because before I can take you through our recent rebranding, I need to show you where we started, so what our branding was before it was rebranded. It's going to set some context, show you exactly where it started. And in the old days, which is how I like to refer to before my time at DHSV, there was a major reliance on primary colours to get us through any design fix. So now in 1993, that might have been a great option and may have fitted quite well, but come 2013, it doesn't quite fit for us, and we recognised that it needed to change. I like to refer to this suite of resources as the 90s nightmare. It's probably a little harsh, and in reality it was probably something like the 2000 and something nightmare, but it didn't really fit with my alliteration, so it's now just the 90s nightmare. And this is it. Now there's nothing necessarily wrong with these resources, there's nothing necessarily wrong with the colours, but I certainly, if I was a patient sitting in a waiting room somewhere, contemplating what's going to happen next in my appointment, thinking about what kind of information I need, this certainly isn't jumping out at me and saying, read me. It's certainly not conveying an easy message of, I'm going to tell you this. The titles themselves are quite complex, and by the time I've gotten through reading A Visitor's Guide to the Royal Dental Hospital in Melbourne, I'm bored with it already and I want to put it down. Now this isn't a stab at anybody, because the communications team actually would have put these together. So, but honestly, the text is small, it's hard to read, the colours aren't great. The images themselves, this one on the right-hand side, it's on the right track. It's friendly, we know that the guy's at the dentist, he's smiling, he's happy about his appointment, but it's swallowed by the sea of text, and it really doesn't add any value to that publication. The one on the left, I'm still baffled by what it's actually trying to tell me. It's not inviting, it's not engaging. It took me that long to figure out what it actually was that, again, I was bored with it before I got started. So you can see we had a challenge ahead of us, but we recognised that we needed to make a start, and that was the perfect starting point. Okay. I'm going to hand around a few examples similar to these ones, just for you guys to actually have a look at a tangible version. Just pass them around. Feel free to keep them if you really feel that way inclined. Just get you past those when you have a look. Okay. As those are going around, actually, if you could do me a favour and make a list of what not to do, that would be perfect. These are prime examples of where you don't want to be with your branding. Now, over the next few years, we started to branch out a little bit from those primary blue and yellows, but we still didn't quite hit the mark with it. The use of the tooth background was actually seen as extracted teeth by many of the clinicians we spoke to, which, from a comms perspective, didn't even think of it. It never crossed my mind that a cute cartoonised tooth would actually bring about those sort of thoughts for other people. So it was all about talking to people and getting an idea of what was working well and what wasn't. Like I said, we did move away from that primary blue and yellow, but the move towards that pale blue actually had the reverse effect. And when sitting in a waiting room, yes, the title was, a bit easier to read, it was a bit fresher, but it actually faded into the background rather than standing out like the last ones did. So we've sort of done a full 360 with the colour scheme there. And again, it just wasn't working quite as well as we'd liked. So what do we do about it? Well, obviously something had to change. We weren't going to go on with things that we knew weren't quite working well, but we needed help. We talked to as many people as we could about what they thought was working well, and again, what they thought wasn't working well. It was just important to pick out the inadequacies than it was the things that were working well. We held focus groups and did surveys. We chatted to people in the halls and we caught them on the phone. We talked to as many different people as we could with the intention of finding out, if DHSV was a widget factory, what are our widgets? We need to know how people felt about us and how we wanted them to feel about us. What was going to make someone pick up a brochure? What was it that made it stand out for them from the rest? You know, if you are in a waiting room, what is it that makes you want to pick something up? What is it about our organisation that sets us apart? And what are the key elements to our passion, our drive and our care? So we really needed to pinpoint exactly what it was that we wanted people to think and feel about us. So, I've put a big idea up here, but really it was just common sense. We knew the answer all along to all of those questions, but we needed the reinforcement from those focus groups, those surveys, talking to people, just to make sure we were actually hitting the mark. It took, our business, so Widget Factory, our business is our patients. We're different because we provide services for people who might not otherwise be able to access them. What makes someone want to pick up a brochure? Knowing what's in it for them. Now this is the key to any good communication, no matter what anybody tells you. This is one thing I want you to take away from today. It is probably the one key thing to take away today. If you're putting together a brochure, a flyer, a press release, whatever it is, think about the audience that you're writing it for and what they're going to get out of it. They don't care who you are, what you're doing, unless they can see the benefit for them. Now, think about a conversation you've had with somebody where the other person's done nothing but talk about themselves. So, I did this today, and I bought this, and then I went here, and then I went here, and you sort of, you fade out, and you can't pay attention, and you really don't care all that much, to be honest. Without that conversation, without the bit that says, what did you do today? How do you feel about this? People lose interest really quickly, and that was where we were going wrong. We weren't engaging other people in the conversation. We were sending all this information out there, but not taking any back. And we certainly weren't conveying what was in it for them to pick up those brochures. That it was all common sense when we really thought about it, and once we had some evidence behind what we were doing. We know we're here to help the patients, but we need to think about how we could convey that to them. So really we needed to just take a step back and realise that our branding, our marketing schemes, they're not really about DHSV and what we want to get out of it. It's about the patients and what they will get out of our services. And then that idea went a little bit deeper again. So yes, they might get a new crown on their tooth, that's what they're going to get, that's great. Or a filling that they needed, but it's more than that. It's the idea that the patient was actually a real person, that their major concern in life wasn't actually going to be the new technology that we were going to use to put that crown on that tooth. They don't care. What they care about is the fact that they might get up tomorrow morning and not have a toothache. They care about the fact that their child goes to the dentist next time and isn't terrified because they've had a good experience with us. So we really had to think deeply about the benefits of what they were going to get. So yeah, really behind the idea here is that they might smile because of us. Now, so we know that DHSV affects so much more than just oral health and dental health. Behind every patient lies a story that captures the job rewards in a powerful and emotive way. So that's where we started. That's great in theory, but how does it actually translate into a new branding concept? So we decided to shine a spotlight on the emotions, highlight the exact way we want them to feel about us, and demonstrate how we can help them in a way that they can relate. It's the difference, really, it's telling difference between showing someone an apple and telling them what an apple is. So we really wanted to tell someone they're getting, again, the difference between telling someone they're going to get a root canal and then telling them they can play with their kids tomorrow morning because they'll be pain-free. So show and tell. Now, here are some examples of that in practice. So you can see here, the kids are excited, they're happy, they're friendly. It's the nice white background, it's fresh, it's new. And it doesn't just work for cute kids either. It can work in so many different scenarios. And the key elements really are just to keep it simple. So what is it that puts these new branding concepts together? First of all, it's emotive word. That's the key to everything. What is it that this patient is going to feel when they've had the service that they've come in to see us for? The subheading that explains the benefit that the patient will see always starts with behind this smile. The picture, the white background, the friendly, smiling, happy people. they've reaped the benefits of our service, and that's exactly what they're conveying to other people. And the white space and lots of it. There's no god-awful blue, there's no bright yellow, it's clean, it's fresh, and the primary colour scheme, thankfully, is nowhere to be seen. Now, I've got a few more examples here, and I mean, you can see here the difference between those resources. These are some job ads that were created just as an example. They focus on the patient, not the staff, even though we are actually talking to staff. It's about what the patient will reap from our staff getting new roles. And how will you be helping our community by taking on this role? Okay. Again, no white space, clean look, the emotive words. It looks professional, but still friendly and inviting at the same time, and that was a really hard balance to try and work out. We didn't want to look too sterile, like a medical clinic, because that scares people. We also didn't want to look too homegrown, because obviously people need that credibility to be able to trust us. Now, I'll show you a couple of other examples of things, and this is quite a stark contrast. This is our quality of care report from 2010. Some of you might have seen it around, some of you a bit newer might not have. This is our quality of care report last year, and you can see, sorry I'm hiding behind there, you can see quite clearly the difference that it makes with the new branding style. So I'll pass those around as well if you guys would like to see. Okay, so we've seen the key elements, but behind those key elements are this font. And there was a bit of discussion about this and whether it was going to be feasible to use, but we really like the Archer font. I think it's great. It's one of the biggest changes we've made to our style. We've added it to our style guide. Originally, we were using Verdana and Arial, which really didn't lend themselves to much creative thought, to be honest. There was nothing necessarily wrong with those either, but they just weren't evoking the emotion that we really wanted from the font. Archer's smooth lines and round edges make it much friendlier and more modern, keeping your professionalism while conveying that human touch. So again, that balance between professionalism and friendliness. It also lends itself to design a lot more than what Verdana and Archer do. Verdana and Arial do. They're just not flexible like the Archer font is. I'd also just like you to keep in mind another take-home message from today. I'd be very strict around how many fonts you actually try to use in any one document or publication. I'm not sure if any of you have font frenzies sometimes, but they are quite dangerous to the message you're trying to get out. More than two, I would imagine, just creates a chaotic, distracting look to anything you're trying to do. And I try and keep it to under two. It just adds a level of difficulty for the reader that you really, it's unnecessary, and it makes your publications really hard to read. Now, I've got a little prize, and I see Deb's in the room, so I'll have to hide the prize from her because she'll yell. Does anybody know who this guy is? No? Sorry? No? Yes, beautiful. Now, Deb, look away. This is for you. Okay. It is the Mars rover, for anybody who didn't hear. And the reason I'm showing him to you, he is kind of cute in a robot-y kind of way. When NASA sent this little guy out into space to travel hundreds of thousands of miles to break new ground on an alien planet, you know, create history for mankind, do you think they just aimed in the general direction and hoped for the best? Probably not. Of course not even. They aimed it, yes, sure. They shot it off into space, yep, absolutely. But as for hoping for the best, there was certainly none of that. All that time and all that money wasn't going to be wasted on near enough is good enough. And just between you and me, I'm not sure that there is really a near enough is good enough clause in NASA's professional goals. So they used course correction to get that there. And I think they landed at something ridiculous like a kilometre within where it was supposed to be. But that's the key message that we need to take here. There's no point in putting all this effort in if you're just going to throw it out to the wind and hope for the best. We need to course correct constantly to make sure that all of these things are still relevant for our organisation, making small changes all the time, which I'll get to in the next slide, but making those small changes just means that we keep all of these things relevant and we're still on top of the ball. Okay, that was the other thing. I said there was one key message from today. This is actually a second key message, so please take this home too, write it down. Course correction is so important. Now, that's why you might see some things like these resources whose emotive words aren't necessarily emotive. They may be, free might be emotive for some people, but they're not necessarily confusing what those brochures are about with extra wording. We've used free and healthy teeth there as the emotive words, like I said, just to not confuse the issue. If that's sitting in a waiting room, you know exactly what it's about. Free dental care for children, healthy teeth, healthy pregnancy. That course correction, we did have many discussions about that, and this is one of the outcomes of those course correcting discussions. We realised that the emotive word needed to be more flexible. We noticed that it wasn't practical for all of our publications, and that's exactly where we went with that. Okay. Now, here are just some more examples of how we've been using our branding. So these are posters and banners that you might see around web pages, brochures, and then you might even see some signage updates, web page updates in the next few months, all going to plan. So that's where we're at with our branding, and you'll continue to see changes rolled out over the coming months as well. But so far, I think we like the direction that we're headed in. Now, some of you might be thinking, yeah, that looks great and pretty and that's fantastic, but what does it have to do with me? Well, it relates to good communication and social media, I suppose, as it's all interlinked. Without the solid branding base, our communication tools would actually be useless. I like to think of branding as the road, I suppose, and all of the tools that we use as vehicles. So if we've got a nice smooth road to travel on, all of our vehicles are going to get to where they're going a lot easier. Also, without the branding, we have nothing. I mean, now that we have that bit right, we can move on and start to get some of our tools right as well. So let's take a closer look at some of our vehicles. All right, I've got another video for you. So hopefully, fingers crossed, this one will work. Bear with me. Some of you might have actually seen a video similar to this, or this one in particular. But please. Okay. Again, there's no sound, but we don't need sound for this either. Okay. So there's just a couple of quick little facts for you. All right, to give you an idea where we started. Now, I'm not going to stand here and tell you that social media is the be-all and end-all of everything. I don't know if it is. It might be, but I'd be lying if I said that I know that. I can imagine 30-some years ago, somebody like me was standing up in front of a room full of people like you, telling you that there was this great groundbreaking new machine called the fax machine that was going to change the world. And it did for some time, but it had its time and now it's gone. So I can't guarantee to you that social media is going to stick around forever, but while it's here, we've been trying to utilise it as well as we can. Now, that being said, did anyone spot the spelling mistake in there? You did? Ah, you were first, Michael. I have a prize for you too. I'm that annoying person that goes to dinner and spots the spelling mistake in a menu and makes everybody aware of it. My friends don't forgive me, so I don't expect you to. Okay. And well done. That was impressive. Now, that's all well and good. Great. There are people out there that are using social media, but what does that mean? Well, we know that people are out there, we know they're talking about things. They're having conversations, and we need to get involved in those conversations. We're taking that information, that knowledge that people are out there and talking, and we're turning it into, or at least attempting to turn it into some business strategy. We've started with the basics, and we're course correcting all the time. It's that word again. We've dipped our toes into just the water, and so far so good. We've seen the surge in social media use as an opportunity to connect with the community on a couple of different levels, and keeping with the thinking behind the branding exercise, we've thought about how our stakeholders might want to get out their information from us. And we actually also thought about, are we limiting ourselves by only providing print resources? And depending on the audience, the answer is yes. We've taken on board that the community members might not always have nice things to say about us, which might be terrifying for some of you. And we hope that's not the case, but we really need to be realistic around this. So we've created policy and procedures to help us get out of sticky situations if they arise. Overwhelmingly, the feedback has actually been really positive. We've of course had a couple of cases of negative comments, but I assure you that dealing with those quickly and professionally has meant that we are able to keep up our communication with those people and keep them on our side, rather than having them sit on a tram or in a waiting room stewing over whatever it was that they needed to comment. And then sharing that negativity with their friends and their families, who also are more than likely prospective patients of ours as well. Now, providing an instant venting space, like I said, might be terrifying for some of you, and it certainly was for us as well. It took a little while to work out whether this was the right thing to do or not. But I think, should you choose to take a leap into social media, you'd probably be pleasantly surprised with what people have to say about you. Now, we currently have 168 likes on our Facebook page. For those of you who don't know or use Facebook, a like is a number of people who volunteer to receive messages from you. We also have 640 followers on Twitter, which, I mean, it seems like a huge gap between those two numbers, but Twitter's actually been running a lot longer. We launched that in November 2011 at our AGM. Facebook's only been up and running since January this year. We use the channels to advertise, share news, share fun stories with a dental angle, and communicate important messages. So we've used it in the past as an example. There was a tram shortage outside the hospital and patients were finding it hard to get here. So we had that all over our social media channels and people got the information. Also, I guess if so happened to be a public oral health conference happening on a Saturday someday, we would share some of that information as well. I'll just show you what it looks like today. You might actually spot yourself. Okay, so this is our Facebook page. I'll need to log in. It's going to work for me. Beautiful. So this is our Facebook page. Again, the branding rolling over to everything that we do. I don't spot anybody here. No, nobody here. But these are just some of the things that we posted in the last week or so. So you can see there's a variety of stuff. We never limit ourselves to just dental information. It can get very dry very quickly. And it could be anything and everything, that as long as we're keeping people engaged with us, we can slip our messages in between, but we need to make it exciting enough for them to warrant volunteering for our information to come to them. Okay. So feel free to check out our Facebook and Twitter pages if you have those services. Is anyone here actually following us on Facebook or Twitter? Just curiously? Yes? Yes? You don't count. That's great though. Is anybody going to follow us now that we've talked about it a little bit? Yes, absolutely. We'll get as many photos of that as we can. That's right. For those who don't know, Deb Cole, our CEO, will be partaking in the Vinnie's CEO Sleep Out next week. So good luck with that. Hopefully the weather cheers up a bit between now and then. So really we're using these tools to connect with our audiences, whoever they are, in any way we can, just to get the connection happening. Once we have their attention, we can slip in our messages, like I said, but and something a bit more substance, but we need to keep that engagement up. So far we have government agencies, dental providers, other health providers, students, staff, other hospitals, and people that we don't even know following us. Some interact, some don't, some repost stuff, some don't. It doesn't really matter. The building blocks of the relationship are there, and we can connect with them easier now that we have actually got that base there. Amongst other things, we've facilitated a chat with consumers around oral health with the help of Bupa. So Professor Mike Morgan actually answered questions live from Twitter with the help of Bupa, like I said, who do a weekly health chat. We've promoted countless other organisations' PR efforts through our Fido Find on Facebook and Twitter, which is we will highlight something cool that other people are doing in the health world to get their messages out there. We've given our over 100 top tips on Mondays. We do a top tip from Mike Morgan via Twitter. And we've used social media to put patients in touch with specific departments when they've requested special needs or messaged us privately on Twitter or something, but they've gotten in contact with us and the outcome has always been positive. Okay. Sorry. Again, talking about Deb, it's the Deb show. This article was on the Vinnie's Facebook page and we shared it. So again, we're using it for co-branding with other organisations and interacting with other organisations too. We're constantly sharing the DHSV brand and that's what it's all about, I suppose. The best example I could think of for this was Red Bull. Everybody knows who Red Bull is. I'm quite a fan, as most of you who know me would know. They have their name on every extreme sport you can think of, whether it be snowboarding, BMX riding, car racing, it doesn't matter, and they're not necessarily related to their product, but you know that Red Bull are interested in extreme sports and those people drink Red Bull. Okay, so they're a prime example of how branding and getting your name out there constantly really works for you. Now obviously we don't want people out there who drink Red Bull to be related with DHSV necessarily, but the point is that branding, the consistency and the simplicity is everywhere, much the same as what else is. That's where we're headed anyway. Now, is anybody here terrified of the word social media, by the way? Is anyone just absolutely...
And I'm not afraid to say it.
Yep, that's absolutely fine too. What I really wanted to get across today was that's okay. It's absolutely fine. And we have dipped our toes in the hopes that it works for us and that it's the right tool for us. If you don't think it is the right tool for you, then that's fine. What I would suggest though is giving it a go in your personal time just to see how to use the tools and what they can do for you. I'm absolutely fine with you saying, no, that's not the right fit for us. But if you sort of turn your nose up and say, oh, no, it's dumb, without actually understanding what it is and what it could do for you, that's where I think the issue would lie. My mum is a prime example of that. That actually was her definition of Twitter. It's dumb. Every time anyone talked about it, and she never used it. She had no idea what it was or even the principles behind it. And so I showed her and I set her up and she's connected with, she loves this guy named Kevin who's on the TLC channel, but he wrote a tweet to her one day and she was just ecstatic. And ever since then, she's not texted or called me once, she tweets at me. So you may be very anti-social media or terrified of it, but give it a go, see how it works, and then decide whether it's a good way to go. Okay. That's also another thing is, just because you have the resources to set up a channel doesn't mean you have the resources to keep it going. It does take hard work and a lot of planning. So put some thought into exactly what you want to tell people and why, and think about events that are coming up that you might need to get across. But there is some planning involved and it is a resourceful job. We actually have an online communications officer who takes care of all of our social media stuff. She does an amazing job, Ming. But that doesn't necessarily mean that you guys have the resources to do it full time as well. All right, now DHSV uses these tools to keep our finger on the pulse of the sector. So with the dental sector, the wider health sector, we keep our feelers out for what's going on politically with our patients and with other organisations, and we don't just use them because everyone else is doing it. Okay? So that's take-home message number 3. If you're thinking of jumping on the social media bandwagon, please think about why. And we're here to help you. If you feel like you might want to dabble in a Twitter account or something, let us know and we can talk you through our process, exactly what we did, how we got started, and give you some tips and pointers. The other thing is that there is so much more out there than just Facebook and Twitter. Social media, as you can see, it's not a great image, but there is so much to it now that you could spend years just researching all the different kinds. So have a think about exactly what you want to get across. Also, LinkedIn is another way, a great way to get started. Alyssa, I think you might be touching on that in your presentation at 3:30 if anyone's interested, but that is a great place to start for organisations. Okay, so you've got your social media down pat, your branding's looking schmick. What else is there? One of the other key things that we use is actually traditional media. Now, again, this can be quite a scary place to traverse, like social media, but if you have a plan and some ideas, I think it's not as daunting as you might think. When it's done well, traditional media can actually help us to reach so many people with the added credibility that the publication that you're targeting actually, I guess, for lack of a better word, is endorsing what you're saying. You've got that added credibility to it. It's not always easy to engage the media, but building relationships can be quite beneficial and rewarding. Now, I don't have a prize for anyone who spots the irony with the photo of Minister Plibersek. These are just a few things that DHSV has had covered media-wise in the last sort of few months though. We've had both state and federal ministers in to launch programs in the hospital and in clinics and kinders across the state. Photo of Minister Davis was taken recently at the launch of the Victorian Oral Health Promotion Plan at Ashwood Children's Centre. The centre was kind enough to lend their staff and students and their facilities to us for the launch and for some media photos, and the Herald Sun ran with that. The photo of Minister Plibersek was taken at RDHM during a press conference that she set up in January to launch the Victorian Dental Graduate Program. And these programs probably would have gone by fairly largely unnoticed in the community had we not sort of put some initiative in and told the community what was actually happening. Coverage also promotes to, when we say community, I don't just mean the patients in our community. It could mean other health organisations that we could possibly partner with, means government agencies as well, so they know what we're doing. So community is actually a lot wider than what you might initially think. Again, Deb, it's the Deb show. This article was published in The Age a little while back now, but again, we are getting our face out there in as many places as we can. We try and put Deb's face on front of as much stuff as we can too. She's a great advocate for better oral health for Victorians, and we're trying to put that out there to as many people as we can. Now, everybody's heard of our Smiles for Mars program? Yeah. Our comms team actually has quite a close connection with the Smiles for Mars program, and I think the girls are actually talking next door about that right now. But we play a big part in their media engagement strategy, which is part of their reward program. Each site is supposed to at least attempt to engage some media during the year, and we help them to write those press releases and get that coverage that they need with follow-up phone calls or whatever it takes to get that information out there. The fact is that journalists are quite time poor, and that actually creates a great opportunity for us, because if we can provide them with all the tools that they need to publish a good story, it just makes their job so much easier. So we try to put together a good little package of a press release, photos, quotes that they might need, and remove all the barriers that they might have between them publishing our story or not. Also keep in mind that editors need to fill 20 to 30 pages of a local paper every week, so there's always space coming up. So get to know your local paper editor, journo. There might actually turn out to be quite a beneficial relationship for you to have. If you are going to engage media, I would very much recommend that you think about what is the important story that you want to get across to them. So why are you calling them? Again, what's in it for them? And if they contact you, don't panic also. Let us know for sure, and we can give you help to get through that liaison process, but don't panic. Focus on the key message again, and link all the comments back to that. Just focus on that one key message. And again, if you have a crisis or and maybe perhaps a negative thing that comes up, let us know so that we can get across it before it comes across our desks, and we can help you out with that situation. If a journalist contacts you, your first question should probably always be, when is your deadline? Work with them to get them the information. If you can't get it to them by the time they need, tell them that up front. There's nothing worse than burning a bridge with a journalist who you might need, especially when you're working in locally, when really you knew all along that you probably couldn't get the information that they needed. And most of the time they'll be flexible and they will work with you, but be honest. Papers love a good photo opportunity. So if you've got some bright, happy, shiny kids, or a fruit bowl that looks great, think about the ways that you can get nice bright colours and smiles across. And again, be clear about what you're trying to say. Don't just call them and say, oh, we thought you might like to come down and take a couple of pics. Think about what you actually want to get out of it. Sorry. Okay, so we're a little bit ahead of time, but basically what I wanted you guys to take away from today is that we are always looking for potential media stories. We would love to hear from your agencies, your clinics, your people about how we can promote what we do out in the community. What is the public dental sector doing for people? If you have something that you think is media worthy, or even something that's kind of cool that you don't think is media worthy, let us know. We've got a new section on our website called Our Stories, and we'd love to fill it with your stories. And also, like I said, we'd love to get it out into the wider community through some traditional media. You can also contact our communications team anytime you like about anything you like. If you hadn't told yet, I actually like to chat, so give me a call, we'll have a chat. Also, if you'd like some advice, I can give you some of that too. Ming and Jennifer are great when it comes to online stuff, so they can help you through anything you might need to know about that. And Robin and I, Robin's in the back there, wave Robin, can help you with the media side of things.